Hey everybody, this is James Doan. I wanted to do a quick video that kind of gives an overview of how muscles get their names. This is going to be an introduction. I can do other videos that get into more detail, but I wanted to talk about it kind of specifically for artists. So there are a lot of artists out there that want to draw figures. They want to draw people, but they want to better understand the muscles so they can draw figures more accurately. So they try to learn a lot of anatomy, and it's difficult. It's very difficult to learn muscle names. So I wanted to talk a little bit about how they get their names. Um, you can do this if you're just wanting to learn muscle names. So if you need to learn muscle names for school or whatever reason, this will work for you. But if you're an artist wanting to do figure drawing and you want to get a little bit more serious and learn some muscular anatomy, but you're just getting confused on the muscle names, this is the video for you. So a little bit of quick background about me before we get started. I am a lifelong artist, been drawing since I was like 5. Uh, do a lot of different kinds of art, but focus a lot, especially recently, on portraits and figures. And I will put some links in the description to my social media. So if you want to see my work and help support me, it's greatly appreciated. You can go check those out. You can like, subscribe, follow, do everything to just kind of keep up to date on what I'm doing and help support me. It's much appreciated. I am also an engineer, so I have a PhD in engineering biomechanics. Biomechanics is just human motion. It's just dealing with human motion. So I have a very strong background of musculoskeletal anatomy, the joints, the bones, the muscles, how the body moves. So I want to do this course because it's a good combination of my biomechanics background of understanding human anatomy and my love for art. So I'm going to kind of bring those together and help teach you how to learn muscle names. I'm going to use illustrations in this video from George Bridgman. Now, if you're not familiar with George Bridgman, he's written several books. I won't go into the background of Bridgman, but great resource for learning anatomy. The main reason I'm using his illustrations, one, they're great illustrations. He has some phenomenal drawings showing how the body moves, you can kind of draw the figure to be dynamic and understand the muscles. But I also hope that for one, I hope it's going to be something you're going to recognize. So if you've been studying Bridgman, you'll recognize these illustrations. But I also hope this will help you study Bridgman. So the fact that I'm using these figures to help explain the muscle names will hopefully help you understand how to actually study Bridgman. All right, I'll talk about his illustrations and what some of them mean kind of as we go along. I'll be using mainly constructive anatomy and drawing from life. I'll put links to these books in the description if you are interested. One quick note, I don't consider Bridgman to be a beginner's kind of level, so if you are brand new into figure drawing, they may not be the best books for you. I would still recommend getting them, but it's probably going to be a resource you're going to use as you get a little bit more advanced. Okay, so there are a lot of muscles. There are over 600 of them. And I'm just going to bring up a few names here to kind of give you an idea. Muscle names are complicated. And if you're trying to learn them essentially blindly, you're just memorizing names, it's very difficult. But these muscles are not named blindly. The muscle names come from something, right? There's a method to naming muscles. And if you understand that method, man, it really simplifies learning the muscle names. I've taught biomechanics both in engineering departments and exercise physiology departments at university levels. And when I taught students how to memorize muscle names, this is the method I presented to them. I explained how muscles get their names in order to make it easier to memorize muscles. So there is a method to the madness. It may not seem like it, but they get their name from something. So if you understand that, it's a huge help. So muscles are usually named based on 3 things. 1, visual appearance, what the muscle looks like. 2, anatomical location. And 3, function. All right. And we're going to talk about each of these and give some examples. Now, I'm not going to give a ton of examples because, again, this is kind of an introduction. If you want more detail, post in the comments, and I'll gladly put some other videos together that go into these in more depth. But this is kind of an overview. So let's start with visual appearance. So when we think visual appearance, it can mean a lot of things. The main stuff I'm going to talk about, and I'm going to give brief examples of these, would be shape, size, number of divisions, and I'll kind of explain that in more detail in a minute, and then fiber direction. So let's talk about shape, and I'm going to give an example of one. It's the deltoid, and this may not be an obvious one as far as shape, but deltoid is labeled 1 in the figure, and it's actually a muscle name that even if you don't know a lot about muscles, you may know the name of the deltoid. It's the big shoulder muscle, so the big bulge shoulder muscle that everybody thinks of essentially as the shoulder muscle. But it actually gets its name based on the shape. And that comes from the Greek letter delta. Okay, it's actually not the lowercase delta, it's the capital delta. And it's a triangular shape. So the deltoid, when you think about it, when you look at it, is a very triangular shaped muscle, right? It's wide at the top and then kind of narrows down to a point where it attaches to the arm. So the deltoid gets its name from the Greek letter delta, which is just a triangular shape. So let's look at another example of shape. And this one's more obvious. We're going to look at one in the back, and that is the trapezius muscle. So the trapezius, again, may be a name that you know, even if you don't know a lot of muscles, but it's that large muscle that connects from the neck down into the back. So that's the trapezius muscle. And it gets its name based on its shape. And you may be able to guess that it's based on a trapezoid, right? So the trapezius muscle has a very trapezoidal shape to it. So the trapezius gets its name from the fact that it's shaped like a trapezoid. Let's talk about size. So a big example here is going to be in the pecs. So a lot of people know the pecs. It's kind of the short name, but pectoralis muscle group. So there's a minor and a major. The minor is labeled 1 up in that right-hand corner figure, and then major is labeled 2. So, all right, we have pectoralis muscles. There are 2 of them. We need to differentiate between them somehow, right? So we have a major and we have a minor. The major is the big one. The minor is the little one. All right, so fairly obvious. It's one of these things that gets used a lot. But if you don't really know that that's what major and minor is telling you, then, you're just, again, blindly memorizing the name. But when you see major and minor, it's telling you that there's a big one, major, and a little one, minor. All right, so those are just size terms. Some other examples. We got a teres minor and a teres major. So again, minor, major, so little and big. Gluteus maximus versus gluteus minimus. So maximus and minimus, again, are just size terms. Maximus is the big one, minimus is the little one, right? Adductor brevis versus adductor longus. So brevis and longus are short for brevis, and longus is long. So adductor, we'll talk about that. That's actually an action or a function. So that's actually naming it also by function. But it's an adductor muscle, but there's 2 of them. There's a brevis, there's a short one. That's the brevis, and longus is the long one. So you'll see these size terms a lot. And if you understand or you kind of start watching for those, it really starts to help you when you're looking at a diagram and you're trying to pick the, adductor brevis versus the adductor longus. Well, look for the short one and look for the long one, right? So those are just terms that are going to tell you the size. All right, let's move on to number of divisions. I'm going to pick an obvious area here in the arm. We're going to talk about bicep and tricep. So bicep is, when people think about muscles, they think about a bicep, right? Well, that's labeled 1 in the diagram. And then tricep is labeled 2 on the diagram just to kind of help you locate them. Biceps. Okay, bi means 2. So the biceps have 2 divisions. So that muscle basically splits into two parts, right? And the biceps have a long head and a short head. So bicep, that term bi is telling you that it has two divisions. It splits into two parts. All right. So it's long head and a short head in this case. Triceps, tri means three. So it's telling you there are three divisions. In the case of triceps, there's a long head, a medial head, and a lateral head. All right. So there are three divisions. Quadriceps have four, right? So you'll see these terms or kind of these descriptors in muscle names that are telling you how many divisions that muscle has. Now, a quick thing we'll see in a second is dealing with location. The tricep heads, medial and lateral, those are directional terms. I'll point them out in a second, but medial and lateral should tell you something if you know directional terms. So again, bi, tri is just telling you two divisions, three divisions. All right, quick example of fiber direction. We're just going to look at one, and that's going to be the external oblique, which is labeled 2 on the diagram. Oblique is what it's telling you. So what fiber direction means is muscles have fibers that run along the muscle group, right? And they run in certain directions. And the external obliques, the muscle fibers run at this angle, right? So it runs at an oblique angle, and that's all it's defining. So it's just telling you the muscle direction, the fiber direction is an oblique angle. So I'm not going to really go into a lot of these, but you will see things that directly tell you fiber direction. Let's move on to anatomical location. So the second way of defining muscle names. So anatomical location can deal with location, which is obvious, right? And points of attachment. Now, I just mentioned location. I talked about directional terms for the medial and lateral head of the triceps. Those are directional terms, all right? Directional terms will help a lot here. Now, if you don't know things like medial, lateral, distal, proximal, all these directional terms, I do have a video that I created, and I'll leave a link in the description that just gives a quick overview of these directional terms. If you learn those, it's going to help you a lot in memorizing muscle names as well as bony landmarks. So you'll see things like medial and lateral epicondyle. Those are just bony landmarks, right? But that medial and lateral means something, right? The anterior superior iliac spine, right? If you know that on the pelvis, anterior and superior are both directional terms. So if you know what those directional terms mean, it will help you tremendously in learning muscle names and bony landmarks. Let's talk about location. Okay, we're going to come back to our friends, the biceps. All right. When people hear the word biceps, they automatically think the muscle in the arm, right? The technical term for biceps, and I'm pointing to it there, it's muscle 2, is biceps brachii. Now, the reason brachii is in there is to differentiate it from another bicep, which is located in the leg. It's actually part of the hamstring group, and that's the biceps femoris. So those are locational terms. So brachii and femoris are telling you where that muscle is located. Now, brachii, when you see anything like brachii, or there'll be other variations of it, that means upper arm. All right. And femoris is telling you the femur, which is the bone in the lower or the upper leg, rather. So biceps brachii is in the upper arm, biceps femoris is on the femur. All right. So those are locational terms, and you'll see them a lot. Again, if you understand bone names, it'll help you a lot in understanding these. But those are locational terms. So let's talk about points of attachment. So there are numerous examples I could give about points of attachment, and I'm just going to focus on a couple. But this is a big one. There are a lot of muscles that are going to tell you exactly where they connect in the body just from their name. The first one we're going to look at is coracobrachialis. So I've got it shown here. This is again from Bridgman, label 1. I've got it circled up there. And I'm going to use this also as a time to explain these diagrams. So I'll kind of explain that right diagram as I go along, because If you don't know what all these dashed lines mean, these diagrams in Bridgman can actually be really confusing, but they give you a lot of information. All right, so points of attachment. First, we're going to look at coraco. So the first part of coracobrachialis is coraco. That is telling you a point of attachment. Now, if you don't know bony landmarks, it's not going to tell you a lot. So again, this is kind of an overview, but realize that understanding bone names and bony landmark names are going to give you a lot of information. But coraco is referring to the coracoid process, which is actually a bony landmark on the scapula or the shoulder blade. This bump up at the top, that's the coracoid process. So now let's go over to the diagram in Bridgman. So if you look at those dashed lines, they are coming from, they're kind of all coming from on that bone, that bony landmark at the top, which is the coracoid process. So it's showing you this muscle, and it's the coracoid or the coracobrachialis, and they're tying to or connecting to that bony landmark. That's what those dashed lines are telling you, is that they connect to the coracoid process. But anyway, coraco is just telling you coracoid process, which is a bony landmark on the sternum. Or the scapula, rather, sorry. Brachialis is telling you the next area. Brachialis, we've seen this before, but brachialis is just upper arm. So it's telling you that it's connecting to the upper arm, which is also where those dashed lines are going to in the Bridgman diagram. So the upper arm is just the humerus bone. So it's telling you, anytime you see brachii or brachialis, again, I've mentioned this a little bit ago, but that's going to tell you upper arm. So the coracobrachialis has the origin at the coracoid process on the scapula, and the insertion is mid-shaft of the humerus. So it is telling you exactly where it connects. Let's look at another one. And this one's going to be more obvious to artists. And that's the sternocleidomastoid. So if you are doing figure drawing and you're learning muscles, sternocleidomastoid is probably one of the early ones you start to learn. And it's mainly because when you're doing figure drawing, the sternocleidomastoid really stands out in the neck. You can see it fairly well. So it's one of those landmarks that figure artists look for as something to show in the neck, right? So sternocleidomastoid is one that figure artists do a lot. So that's why I wanted to kind of point it out here. But that name, it's a long, complicated name, sternocleidomastoid, but every part of that name is telling you where it attaches. So let's start with sterno. So sterno, you might be able to guess this, is telling you it's connecting on the sternum, and I've got it shown with a red circle there. It's actually connecting to the manubrium, which is the upper part of that, but it's the sternum. So sterno is telling you that that muscle is connecting to the sternum. Cleido, okay, and this one won't be as obvious, it's coming from the Greek term, but when you see cleido, it's just telling you clavicle, all right, and I've got it circled as well. So cleido, when you see cleido, just think clavicle, and again, it's coming from Greek terms, but that's not real important. The main thing is just to kind of start learning the terminology here. So when you see cleido, it's just telling you clavicle. So the sternocleidomastoid attaches to the sternum and attaches to the clavicle. Now we move to mastoid. That's telling you the other end of this muscle. And it's referring to the mastoid process, which I've got it shown in the circle there. If you feel behind your ear, you'll feel that bump. There's a big protrusion right behind the ear. That's the mastoid process. It's actually a bony landmark on the skull. So it is telling you that it connects to the mastoid process. So the sternocleidomastoid is just connecting to the sternum, the clavicle, and the mastoid process. All right, let's talk about function. Again, I'm not going to give too many examples here, but I just want to kind of define that the third way muscles get their name is going to be based on function. So let's talk about a couple that are in the forearm. First one is a supinator longus, and I've got it referenced here. First of all, longest should tell you something, right? That's another term based on size. But supinator is actually telling you the function, and it may not be obvious if you don't know movements, which is why I don't want to give a whole lot of examples here because I'd really have to go through different actions. I'd have to define what all these mean. But supinator longus supinates the forearm. So if you're not familiar with that, if you hold your forearm out with the palm down and then you turn your palm so that it's palm up, that action of turning palm up is supination. So that's what it is. It supinates the forearm. All right. Contrary to that is pronator teres, which pronates the forearm. So now if you've got your palm up and you turn it palm down, that is pronating. So that pronates the forearm. All right. So those terms in there are specifically telling you what action that muscle does. All right. Some other examples, and again, I'm not going to go into these a lot. Adductor brevis, right, is going to adduct. An adduction motion is bringing something closer to the midline of the body. So if your leg was extended out to the side and then you bring it toward the body, that is adduction. So adductor brevis, which by the way, brevis should be a term you already have seen before, is going to do adduction. Flexor is going to be a term along with extensor. When you start seeing flexor and extensor, flexor is going to be a muscle that flexes, and an extensor is going to be a muscle that extends. All right. Again, not going to go into a lot of examples because if you don't know these actions, then they don't really mean much. But as you're studying these muscles and you start seeing these names, start to recognize that they're just telling you exactly what the muscle does. All right. Now, a lot of muscles are named on combinations. I've already pointed out some, but I'm going to do another quick one here. Flexor carpi radialis. I'll give you a second. What do you think flexor carpi radialis does and where is it located? Any ideas? Let's look at it. So flexor is telling you the action. Carpi radialis is telling you location. Think about it a little bit more. What do you think this does and where do you think it's located? All right. Flexor is telling you it does flexion. In this case, it actually does flexion of the wrist, which again, if you know what carpi radialis means, you might have already figured that out. Because carpi radialis is just telling you that it inserts on the metacarpals. That's what carpi is telling you. And it's on the radius side, and the radius is a bone in the forearm. So it's attaching to the carpal bones, the metacarpals on the radius side, and it flexes the wrist. So that is a combination. It tells you what that muscle does, and it tells you where it attaches. All right, much easier than trying to memorize that from nothing. Anyway, I'm going to stop there for this one. Thank you very much for watching. Again, I'll have links to different things in the description here if you want to see more of what I work on, different paintings I've done, different drawings I've done, and I do some other videos. I've got time-lapse videos if you want to watch those. Let me know if you want me to do more on this kind of series. I can go into more depth on the three different ways that muscles get their names, more examples, more details. But I just wanted this one to be an overview. So I hope it helped you. I hope now when you start seeing muscle names, you won't just blindly try to memorize them. You'll try to figure out how they got their names so that you can better memorize them. So good luck. I hope this helped, and go out and learn some muscles.